Welcome to Alzheimer'sMD.org. The earliest signs of memory loss are critical to success with winning the war with Alzheimer's. I'm William A. Van Horn, MD. I'm a medical doctor who specializes in Alzheimer's disease, also specializes in all levels of memory loss. And I can tell you right now, the best place to have your best chance of avoiding disability and truly advanced Alzheimer's disease is early. Why is that? The reason is that the brain is dying over decades, and the reason you lose memory is because cells die. So if you get treatment with some really good medicines, and I believe in a broad-based treatment that I know slows down memory loss because I've seen it, and I've seen it delay for 5-10 years, what you would compared to what you'd expect with no treatment, significantly delay the progression of memory loss. So the earlier that you identify the memory loss, the more memory cells you have to treat, and the medications work on living cells. So what are the early signs? One of the difficulties with identifying early memory loss of Alzheimer's is that it's immediate memory. You can have people, you can have a grandmother who can tell you about 30 years ago, 20 years ago, 10 years ago, details like better memory than you might have. And I hear this all the time. Someone will bring a family member that I should bring him in for something on maybe sleep. And I do a memory test and I'll say, well, you have the early memory loss of Alzheimer's disease. So we need to start treatment. And they'll say, oh, no, she has a great memory. Oh my gosh, she has a better memory than me. But see, where memory loss starts at Alzheimer's is immediate memory. It starts in the brain, the part of the brain called the hippocampus, which stores immediate memory. So basically what you have is to have a memory, first of all, you have to have some kind of stimulation come. Let's say verbal stimulation, someone tells you their name. Then that has to go to the part of the brain, the front of the brain, where you concentrate on it. How many times have you forgotten a name because you never really heard it? So you concentrate on it. Then it goes to the transfer part of the brain for the immediate memory, which is the hippocampus, and that's where you start storing an immediate memory. Then it goes from there to long-term memory, which is another part of the brain. So people that are losing their hippocampus, which is early Alzheimer's, can't retain new memory. They can't transfer it to long-term, but they can retain all long-term memory. So therefore, people lose memory from now going backwards. So the critical thing of testing for early memory loss is, can they learn new things? And the simplest way, people want to give me all this, what do you want to look for? What do you want to look? First of all, what you want to look for is how old are they? If someone is over 60, they should be tested annually for early memory loss. And the test is called a mini-cog. It's on our website. Go to it. You can do it with your family member. It's 90% sensitive, 90% specific, and it picks up early memory loss. That consists of remembering 3 items over 1 minute after being distracted, and the other one is a clock drawing. The other simple test you can do is get a circle, and every year have the family member fill out the clock drawing with the numbers of a clock. If you start seeing it get abnormal, then you know you're there. And what does there mean? There means that you're at that point that as you lose more cells, you can lose cells for about 30 or 40 years without losing memory, but you hit a point in aging that when you start losing, that once you're losing cells now, it's actually costing you memory. You've used up your excess. I call it the reservoir. You know you're at that point. That's when you start treating the brain. That's when you start boosting all the neural circuits to keep the brain alive longer and keep the memory alive longer. So the simple test is annually do a mini-cog, and you will catch the memory loss very early. Thank you for joining Alzheimer'sMD.org, the place where you learn how to prevent memory loss, how to slow down it once it starts, and how to take care of the quality of life and improve the quality of life of your advanced Alzheimer's family member. We have an exciting new guide that summarizes my approach, my medical approach to Alzheimer's disease, showing what medications are bad for your brain, that accelerate memory loss, showing medicines what are good for your brain. Download it now.